Toothache can be extremely painful, and it can occur even in mouths of someone who's never had a cavity and who's been going for regular checkups and who brushes and flosses, and all of a sudden there's a problem. And it can be extremely painful. It can be a sharp, incredibly penetrating pain, or it could be a dull, throbbing pain. And it doesn't mean you've done something wrong, but what can happen, what the message I want to get across is that there is no one solution to all toothache. Before you treat a toothache, you need to know what kind of toothache you have. And the problem is, if you treat a simple, easily reversible toothache with the wrong therapy, you can turn an otherwise simple problem that will go away within a couple of days into something that is extremely expensive, that will take time. It may involve the death of your tooth, a root canal, an extraction, an implant, some things that you absolutely do not want to do if you had a simple problem that could have been reversed easily. And the easy solutions are usually the ones to try first. But there are some symptoms, and symptoms are the message that your body is giving you that there is a problem. And the symptom we're talking about today is toothache. And in order to decide what kind of toothache you have to stop for a minute, or if this is a child of yours, ask some questions. What kind of toothache is it? Because there is a sharp, painful, like a stabbing pain, like a, ooh, that really hurts kind of toothache. And it can radiate. It can radiate along several teeth. It can be radiating within your jawbone. It can occur in your face as a kind of headache or even in your skull. It can be down low. It can be throbbing, pulsating, almost like you've got some kind of heartbeat inside your tooth. And these are all symptoms that you can use to determine what might be happening. And really, the absolute message here is don't pick something like clove oil or tea tree oil just because they sound natural and put it on a toothache or on a gum ache, because you might turn a simple ulcer that will heal naturally in a couple of days into a substantial problem where your tooth dies. And I'm going to try and explain why that happens, when that happens, and what you need to do first instead of diving for what you read on the internet, which today is pretty much telling most people to use clove oil. And I have a whole video about why you shouldn't use clove oil unless it's an absolute last resort when you're being woken up in the middle of the night, you can't get to a dentist or an emergency room, and you need to do something. That is the only time I recommend clove oil. So with that said, and I put it up here because it's the dosage of clove oil that is so dangerous, so damaging, and you should never, ever, ever use clove oil in the mouth of an infant or for baby teeth unless you are in the hands of a dentist. As a pediatric dentist, yes, we used clove oil. We would put it on a cotton ball and then seal it inside the tooth. But what you don't want is that clove oil to get on the skin, and it will dissolve in saliva. Your baby could swallow it. It could make your baby very, very ill. You could get DNA damage. You can get seizures. You can burn the skin of the baby's nose by regurgitation. It's something you absolutely should not be using in the mouth of a baby. Xylitol, granular xylitol, which you should be able to get from a grocery store, online, on Amazon, granular crystals of xylitol. And keep a bag handy if you're a mom with a baby. And actually, it's good to put on erupting baby teeth before they have a problem. Every time you see a baby tooth erupting and you have time on your hands, get a few crystals of xylitol, dissolve them in water, and just rub them over your baby's teeth. And you may avoid completely any kind of tooth eruption problem. I'm a mom of 5. I'm a grandma of 8. We didn't have any eruption problems, but we used lots of granular xylitol, and I mean, by meaning lots of tiny amounts frequently. Just you need a couple of crystals dissolved in some warm water and just wipe them over erupting baby teeth. You can use that also for erupting adult teeth in your teenagers, and also with wisdom teeth in the later teens, early 20s, xylitol, either after meals as a regular thing, will suppress the inflammation because it suppresses plaque, which is the cause of inflammation. And you do that preemptively. You do it before you have a problem, ideally. So use xylitol. Keep a bag of granular xylitol handy for eruption issues. Now, in clove oil, the problem is the eugenol is the active ingredient. And it sounds like it's great because it kills bacteria, and it also can be an anti-inflammatory, but that's at the correct dosage. And the dosage is so minute, you don't want to be the one dispensing it. If you watch my video on clove oil, we're talking about millimoles. Millimoles are incredibly small amounts, thousandths of a mole. And a mole, 17 moles, would be a pinch of salt. So be very careful in trying to be the dispensary for anything like eugenol, clove oil, or eucalyptus. And you can also find online that eucalyptus is very helpful for repairing wounds, for repairing, for example, if you need some sort of gum healing. Eucalyptus is very helpful, but again, it's a very small amount of eucalyptus that we're looking for. So having said that about the use of clove oil or other so-called herbal remedies, which I do not recommend, I would always dive for xylitol first. Let's begin and assess toothache. Toothache can be an irritation. It can be all kinds of irritation. It can be irritation from plaque. If you have bad teeth and cavities, there's a good chance that your gums are very irritated by plaque because plaque produces toxins, and that's almost like a poison to your gums, and your gums get red and inflamed and irritated. Now, you can also get an irritation from getting a piece of popcorn stuck down your tooth. You can have had a lot of acidic fruits. Perhaps you just got a tomato season and you're eating lots and lots of tomatoes because they're so delicious. You can also eat vegetables with oxalic acid. You may love kale and you've been to some party where they made a wonderful kale salad. Things like that can cause ulceration of the skin of your mouth. We'll talk more about that because there are ways to try to protect that from happening. And there are ways that actually make ulceration more possible, more likely, one of which is artificially whitening your teeth with peroxide because that melts away your natural defense system. So I never ever recommend the use of artificial whitening products or peroxide because it leaves you at risk for tooth and gum irritations, which would end up a gum irritation could be bleeding and puffiness, or it could be an ulceration, which is very sore. Can feel horrible to have your mouth ulcerated. You can get a virus infection, which causes ulceration in a baby's mouth, or pregnant women can get that too. And that ulceration can be all over your mouth, and that's incredibly painful. I had that when I was pregnant one time, and I couldn't even eat a pear or an apple. It felt like just, sandpaper in my mouth. So there are things, and there are hormonal changes that make these things more likely to occur, and there are things you can do to soothe and to help. And just on that topic, olive oil can be soothing. If you're in real pain with an ulcer, instead of putting anything damaging on it, just coat it with a little olive oil, or a rinse with a little olive oil, not coconut oil, not stronger oils. Olive oil would be very healing to an ulceration and to your gums. So that's something you could do, or xylitol. And then this irritation could be more chronic. It could be from maybe something that you're drinking, a sports drink that you just started drinking. So if you're getting a lot of irritation, try to think about your habits. What are you snacking on more often, or what are you sipping or drinking more often than you used to? Maybe it's some sort of seasonal fruit. And just, you don't have to cut it out. If it's something that you love, which it probably is, try to have it at a meal time. Try to eat, if you love tomatoes, because they are pretty rough on your skin mucosa sometimes, just eat them. It's so good for you, but eat them maybe before you have lunch rather than mid-afternoon or as a snack. Try to have this thing that might be causing irritation, the drink that you like, or a lemonade is another one that can be pretty acidic and corrosive. Have it during a meal. And then end your meal. This is my message again, over and over. End your meal with xylitol or a tooth protective food like a strawberry dipped in crystals of xylitol so that you protect your mouth. And then don't eat or drink for 30 to 60 minutes afterwards, because that allows the xylitol to nurture the good bacteria in your mouth and build your own mouth's defense system. That's what we want to do, build your mouth's defense system by ending your meals with xylitol, and then do not eat or drink afterwards for 30 to 60 minutes. Main message, so important, and make all the difference to your mouth health. So irritations can be quickly resolved. Olive oil, xylitol, simple habit changes that don't really need you have to go rushing off to the dentist. And how do you know if you should? I mean, pain can be quite sensitive. It can be the sensitivity, it can be soreness, it can be a sharp stabbing pain. And all of that may just be something very simple. However bad that pain feels, if you have some gum recession up at the back, it can radiate all over the sides of your face every time you breathe in cold air, or you drink some chilled white wine, or you drink a hot cup of coffee. It can be so sensitive and drive you crazy because this pain is every time you have anything warm, hot, or cold. And yet, if you follow these directions that we just talked about, limiting damage and protecting your teeth more with xylitol, and I would add to that, change the way you look after your teeth. Use my complete mouth care system. I won't go through the whole thing now, but go to my website, look at the video boot camp, learn how to use these products, use them. And I would say that for most of this sensitivity and this pain, you will solve the problem usually within 3 to 5, maximum 7 to 10 days. Pain gone. No need for expensive treatments. No need for gum grafting, special equipment. What you need is a good toothbrush. You need the right kind of toothbrush to do the right kind of gum massage. All the parts of my complete mouth care system that go together. And you have to stop damaging with the habits, stop damaging with extra flossing. You got to stop flossing if you have gum recession. Stop it and use the rinses and the xylitol and my complete mouth care system as much as possible. If you have to get some piece of food out, do it so gently, because you want this wound. This is a wound. When you have gum recession, you have a wound. You don't pick at a wound all the time. You don't rub string all over a wound when it's trying to heal itself. That would be crazy. And all the instructions I see people being given for gum recession and erosion and sensitivity is to stop brushing. Don't touch the gums. Just floss and use these strong mouth rinses. They treat it as if it's an infection. It's not. It's an irritation. And that is very different. That does not require killing bacteria. It requires building protective biofilm over your teeth to protect them from this irritation, which you also try to condense into meal times and limit the amount of damage being done. And you build the biofilm to be protective. And that takes a little bit of time, but you will feel the effects very quickly. And you want to avoid having unnecessary dental cleanings because that will strip away this biofilm that you need to protect your teeth. So it's a whole different way of thinking. And we will do more videos on this. But for now, just realize if you have this pain, and the reason the pain can be monitored, measure the time it takes for that pain to go away. If you go, ooh, that cold air really hurt my teeth, time it. And if it is less than a minute, that is going to be extremely reversible. Give it a shot. It's well worth it. But if the pain goes on for 2 minutes or more, that would indicate that you have dealt with this for too long without the right remedy, or you have used the wrong remedy, and your nerve inside your tooth is irritated. The very inside of your tooth is now irritated. And when the nerve inside your tooth is irritated, there's a very good chance it's going to die. And that is why if you have this pain for more than 2 minutes, you need to start making a dental appointment and getting there fairly soon, because there's a very good chance that something has killed this tooth, either a cavity that wasn't treated properly. It could be that you've just gone on with this, maybe not treating your tooth properly, or you've used clove oil or something that has now irritated the center of your tooth. And at that point, yes, the pain may go away, but that's not a solution if the nerve and the pulp inside your tooth is dying and dead. Just because the pain's gone away isn't a good thing. It means the nerve, the tooth, is dead. And you don't leave a dead tooth without treating it. And in fact, the sooner you can get that dead tooth treated properly by a trained endodontist, somebody who does nothing but root canals all day long, you will be fine. Do not listen to the fearmongers who tell you all root canals are bad. They need to be done in a very strategic, very scientific, very effective way. And well-trained endodontists are wonderful at doing root canals. And I would recommend, if you have this dead tooth problem, going to see an endodontist. It may be slightly more expensive, but believe me, the end of the story will be success for you. There is a lot of marketing telling you that you're better off to have a tooth out and an implant. I know a number of dentists of my age who are familiar with what's going on, who would not recommend that fear-mongering approach. They would agree with me that a good root canal is far easier to maintain for the rest of your life than an implant, probably in most cases. So moving on here, so the infection could be surface infection, maybe just some gum disease. And again, if you're using the strategies I recommend of habits, of xylitol, and of my complete mouth care system, that will take care of any surface gum irritation, any surface tooth irritation, anything that's on the outside. The problems come when this infection in the tooth or the gum gets to the inside the gums, inside the tooth. The example I would give of the toothache that you will feel from this is it is a dull, it is a deep, it is an ache, it is a throbbing, and it gets worse as you lie down. It will wake you up in the middle of the night. It's spontaneous. It's not connected with eating or drinking or breathing cold air or having a glass of wine. It's like a real ache in your jaw. You need to get to a dentist as quickly as you can. What you don't want, it's almost like a volcano waiting to explode. And that pulsating, throbbing pain is likely an infection brewing in the dead space inside your tooth. Maybe it's even volcanoed out the root of your tooth into the bone. That's why it's so painful, but it's not anything that's going to go away by itself. You could put clove oil on that problem and it might dull the pain. It might dull it somewhat. I think you'd be better off to take some kind of pain medication that you would normally maybe take. But get yourself to a dental appointment because they will release the pressure. This is all about pressure, a volcano pressure building up inside the tooth, waiting to explode, or inside the gums, waiting to explode. And you don't want to wait for that. You don't. So I'm all for self-medication, but if you've got a deep, dull, throbbing pain that comes and goes and wakes you up in the night, whoever you are, however your teeth don't seem to be bad, you think your teeth are great, go to see someone. It is a very unlikely that you are going to do anything constructive to help that pain. And the trouble is, if you start self-medicating, you will have this focus of infection. You will have this ball of infection in your body. And that is when root canals become very difficult to do, because the infection pushes itself into every channel within the tooth. It becomes a nightmare for the endodontist to clean properly. But if you go quickly and get this treated, your endodontist can likely save your tooth, treat it fairly easily, fairly quickly, couple of visits, maybe the course of antibiotics. There really isn't much else you can do. Warm salt water is helpful sometimes, especially if the infection is in the gum. Because if you think about your gum tissue and the infection inside, it will be swelling. And the pain is from the swelling of the gum, and the liquid basically inside the gum is pushing perhaps on your jawbone. And if you bathe your mouth, and this occurs quite a lot when your wisdom tooth is coming through, bathe your mouth with warm, salty water. Put a tablespoon of salt into a little warm water and just hold it over that area. The salt, by osmosis, will pull the liquids from the gum and shrink the gum down a little bit. And if you do that periodically through the day, and then at the end of doing that, maybe you do that 4 or 5 times during the day, then you use my complete mouth care system and brush really well around an erupting wisdom tooth. You may cause it to bleed. You may release some of this pressure. And then the problem with the wisdom tooth, it's trying to get out, and it's pushing against the gum and causing this buildup of pressure. If between the salt shrinking the gum and you brushing really well and creating stimulation around the gum for blood supply and healing and so forth, and getting rid of any bits that may have got stuck down there, perhaps that tooth can come out. You may be able to resolve this by yourself a little bit. Probably still worth going to see a dentist, because you don't want this to blow up as a huge infection at the back of your mouth. So assess toothaches. Do not just dive into them treating, self-medicating as if all toothache is the same, because it absolutely is not. And I hope this has clarified that for you.